Unfortunately, South Korea is among the OECD members with high suicide rates. To address this, the government today rolled out a 5-year plan aimed at lowering this rate, which includes more frequent mental health examinations. Our Lee Soo-jin has the details.
The South Korean government is enacting bold measures to prevent suicide. A 5-year plan aimed at lowering the country's suicide rate was revealed Friday during a meeting of the Suicide Prevention Policy Committee under Prime Minister Han Duck-soo. The government aims to see an initial 30% drop in the number of deaths by suicide by the year 2027, from 26 cases per 100,000 people in 2021 to 18.2.
In 2021 alone, 13,000 people took their own lives. Korea's suicide rate per 100,000 people is the highest among the all OECD nations. This is a very regrettable situation, and protecting the lives of its people is the country's most important duty.
The plan includes measures to increase the frequency and scope of mental health examinations. National mental health examinations will be conducted every 2 years instead of every 10 years. They will also be expanded to include checkups for schizophrenia and bipolar disorder. The biennial mental health examinations will be available for those between the ages of 20 and 34 starting in 2025 before being gradually expanded to other age groups. The plan also includes pan-governmental efforts with suicide prevention policies that are specific to people's jobs, ages, gender, and health. Some examples include the Ministry of Culture, Sports, and Tourism offering private counseling for public figures, and the Ministry of Education making suicide prevention awareness education mandatory for elementary, middle, and high school students. The government will also create programs in 17 cities and provinces across the nation that take into consideration the characteristics of each region. The government will operate mental health programs targeted towards students in new cities and the elderly population in rural areas. The government will also increase the number of suicide prevention hotline employees to up the answer rate from around 60% in 2022 to 90% in 2027. There will also be more mediums available where people can receive counseling, such as social media. These plans are also timely because suicide rates tend to surge after 2 to 3 years after major disasters such as the COVID-19 pandemic. Lee Soo-jin, Arirang News.